Hi, I'm Dr. Trishala Singh, Senior Physical Therapist at Care Hospitals, Banjara Hills. I'm here to put up a word on physiotherapy following breast cancer. Now, breast cancer is the most common malignancy in female patients, but with their improvement in the technology, there has been a lot of treatment options available. There has been an increase in number of survival rates. Increase in number of survival rates has also increased the demand in directing more research and care towards developing interventions which will help in improving the quality of life of a survivor. Now, developing interventions meaning some important things which will help the patient have a better quality of life later after the surgery or after the cancer diagnosis. Physiotherapy is one such intervention which helps in rehabilitation during and after the diagnosis of cancer. No matter what amount of treatment and what type of treatment you have had after breast cancer, be it chemotherapy, radiation therapy or a surgery, there are common symptoms which happen with patients, meaning there can be some neck and back pain, upper back pain precisely, there can be some shoulder pain, there can be some decreased range in the shoulder, decreased strength in the shoulder. Patients might complain of chronic pain, but the most common symptom that a patient develops anytime between 3 to 20 years, most preferably after the surgery, is lymphedema, which affects 1 in every 5 women suffering from breast cancer. Now, coming to interventions. Whenever you talk about physiotherapy for breast cancer, there are two phases which we divide it into. One is a recovery phase and the other is a rehabilitative phase. Your recovery phase happens just after your treatment from 1 to 4 weeks, whereas your rehabilitative phase starts after 4 weeks or up to 6 weeks. Now, coming to your recovery phase wherein you are still in the hospital, the very next day your physiotherapist will come to you, assess you in a proper way, talk to your surgeon and decide a protocol for you. There definitely might be some drain in situ after your surgery. So your therapist will talk to your surgeon on when and what to be started. Then he'll assess you properly and decide about protocol which is a custom made thing for you. Right next day after the surgery, you will be asked to lift up your hand at least 30 to 40 degrees in this movement assisted with the other hand support, and then you bring it down slowly. Same way you are supposed to lift it up sideways as well. Now, the most common problem after a breast cancer surgery is your scar, the tight surgical site which you have. So your therapist will give you some advice on how to release that. That's called a myofascial release technique. He will advise you in treating that. Now, as I have mentioned, recovery phase, important things are 3. One is postural correction because the scar might get tight. The second thing being range of motion exercises to maintain the flexibility of your shoulder, neck and the upper back. Third one being your myofascial release. Coming to interventions of physiotherapy. Now, your physical therapist will talk to your surgeon and then they will decide a treatment protocol for you. Your physiotherapy will be divided into 2 parts. One is recovery phase and the other is rehabilitative phase. Your recovery phase starts right next day from your surgery. Meaning the very next day your therapist will come to you, assess you, talk to your surgeon and decide a custom made protocol for you. Your physiotherapy that time will include 3 things. One is postural correction and postural awareness. Second would be myofascial release because definitely the scar might get tightened. And the third one is your flexibility exercises, your range of motion for your neck, shoulder and your upper back. Now, right next day after your surgery, you will be asked to do some assistive movements, meaning with the drain in situ, you are supposed to lift your hand up only up to 30 to 40 degrees and then sideways as well for 30 to 40 degrees. After your 4th day, 3rd or 4th day, after your drain has been removed, you will be asked to raise it up as much as you can as tolerated with assistance, with minimal assistance. Again, you have to understand that these exercises are not supposed to be done at a faster pace or you have to avoid some jerky movements. Remember to do these exercises every second hourly until you feel better. Now, there are some warning signs in your recovery period where you have to understand that if you have if you experience an excruciating pain, if you see unusual swelling, if you see there is a little oozing from the scar, you have to talk to your therapist and talk to your surgeon and get it rectified then and there itself. This protocol will continue until 4 weeks. After 4 weeks, you reach your rehabilitative phase wherein you will again be assessed by a physiotherapist. He will start you on some rehabilitation exercises. He'll start on a rehabilitation program which comprises of a proper warm-up and cool-down sessions. You will be made to do aerobic exercises for at least 3 to 5 times a week at a mild to moderate intensity and some resisted exercises which you are supposed to do for 6 weeks, which will mostly concentrate on your major muscle groups. Now, as I've mentioned one point wherein lymphedema, it is the most common part. To make sure you avoid that, you have to talk to your surgeon and your physiotherapist on treatment protocols wherein you can avoid it. If you per se you develop lymphedema, talk to your physical therapist. They will treat you with some decongestive therapy. They'll teach you some self-massaging techniques, self-draining techniques which will be helpful, and also recommend some compression guiding garments for you. Happy recovery and thank you.